This video on colon pain is brought to you by healthhype.com. Please note that this video is not intended to replace a medical consultation. Always consult with your doctor about your symptoms. It is important to first understand what the colon is, the different parts of the colon and where it is located. The colon is the last part of the digestive tract. It continues from the small intestine to taper off at the rectum. The colon is spread throughout most of the abdomen. It lies close to several other abdominal organs, such as the liver, stomach, gallbladder, spleen, and small intestine. Therefore, it is often difficult to isolate abdominal pain as arising from the colon. Other symptoms must also be considered before abdominal pain is diagnosed as colon pain. The coiled mass at the center of the abdomen is the small intestine. As its name suggests, it is smaller in terms of being narrower than the colon. However, the small intestine is about 4 times longer than the large intestine. The colon is the main part of the large intestine. It starts at the cecum, which continues from the small intestine. Attached to the cecum is a long thin pouch known as the appendix. From the cecum, the first part of the colon is known as the ascending colon. It continues into the transverse colon, then the descending colon and finally the sigmoid colon, which ends at the rectum. 2 other important parts of the colon are the sharp bends at each side. The bend at the right side is known as the right colic flexure or hepatic flexure, with hepatic referring to the liver that lies next to it. The bend at the left side is known as the left colic flexure or splenic flexure, since this lies next to the spleen. When identifying abdominal pain, it is important to locate where this pain occurs. The abdomen can be broadly divided into 4 quadrants. This includes the right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant. Fluid from the small intestine enters the large intestine and begins its transit towards the rectum. It gradually becomes a semi-solid mush and then a soft solid, which we refer to as feces or stool. This movement through the colon and transition from a fluid to solid is due to 2 main processes. First, the tiny muscles in the colon wall contract and relax in a rhythmic fashion to push the contents along. Second, the colon reabsorbs water from the fluid and mush, which causes it to become firmer. This is an important mechanism for the body to conserve water. There are many possible causes of colon pain. Usually the pain does not occur on its own, but it is accompanied by other symptoms like diarrhea or constipation. Sometimes this pain is not even due to any disease. For example, in irritable bowel syndrome there are episodes of abdominal pain with diarrhea or constipation. The exact cause of IBS is not known. The pain is believed to be due to strong contractions of the colon muscles. Therefore, in the past, irritable bowel syndrome was known as spastic colon. Constipation is a common condition and can sometimes be severe. In these cases it can lead to complications like fecal impaction, where the feces or stool becomes hard and obstructs the colon. Inflammation of the colon is known as colitis. It can arise for several different reasons. Injury, infection, toxins, and an interruption of the blood supply to the colon are some of the possible causes of colitis. Abdominal pain is one of the main symptoms of colitis. Inflammation of the appendix is known as appendicitis. It causes pain in the lower right quadrant of the abdomen, towards the belly button. Appendicitis should always be considered a medical emergency. If the inflamed appendix bursts, it can lead to serious complications and even death. Large amounts of gas are produced by the bacteria in the colon. This gas along with swallowed air can sometimes become trapped within the colon and cause painful stretching of the colon wall. One debated condition that involves trapped gas is splenic flexure syndrome. This occurs in the sharp bend of the left colic flexure. Pain is felt in the left upper abdominal region and usually relieved by passing gas. As we get older, the walls of the colon can become weakened. Sometimes abnormal pouches may form in the colon wall. These pouches are known as diverticula. Most people with diverticula do not have any symptoms. However, if the pouches become inflamed, then it is known as diverticulitis. This is a condition that is more often seen in older people. Pain is a common symptom of diverticulitis. Inflammatory bowel disease or IBD is an autoimmune condition where the immune system attacks the colon wall and causes inflammation. There are two types of inflammatory bowel disease: Crohn's disease, which can occur anywhere in the digestive tract, or ulcerative colitis, which affects the colon specifically. The inflammation may be visible during a colonoscopy and open sores known as ulcers may be observed. There is an increased risk of colon cancer in people with ulcerative colitis. Colon cancer is more correctly referred to as colorectal cancer since the rectum is often also affected. It is among the top 5 most common cancers in the United States, as well as among the leading 3 causes of cancer-related deaths among American men and women. With colorectal cancer being so common, it is important to spot the signs and symptoms as early as possible. Abdominal pain with changes in bowel habit like diarrhea or constipation, as well as blood in the stool and unintentional weight loss, may be signs of colorectal cancer. People with a family history of colorectal cancer need to be cautious and undergo regular screening. Early diagnosis and treatment can greatly improve the outcome. These are only some of the possible causes of colon pain. Please visit the healthhype.com website for a more comprehensive list of causes.